So if you're curious about dermal filler treatments or looking to get it done, here are a few things you should know before going to your first consult. First of all, what is dermal filler? So dermal filler is hyaluronic acid. It's something your body naturally produces underneath the skin to maintain hydration. It's also in the joints to maintain lubrication. So what drug companies do is they take it, they gel it, they make it thicker. And then what we do is we inject it into different parts of your face, different parts of your body to augment volume. So the cool thing with dermal fillers, unlike Botox, is that you see the effects right away. There might be some post-procedural swelling, so you might be a little bit more poofy than you might like, but then after a couple of days, the swelling will come down and everything will go back to normal. So a question I get a lot is how long does dermal filler last? Depending on where it is, it could last anywhere between 6 months, like in your lips, 6 months to a year, or up to 2+ years, for example, if you do cheek or tear trough injections. Bottom line is anywhere between 6 months to 2+ years. What are things you can do to prepare before your dermal filler procedure? With dermal filler, there's always a small chance of bruising. So it's best to avoid alcohol, anti-inflammatories like ibuprofen or Aleve, or if you're on any blood thinners, you can't really do anything if you're on blood thinners. You just have to let your injector know because you'll likely bruise. Fish oils, ginkgo biloba, any of those supplements. So all those things can increase the risk of bruising and swelling. So if you can stop it a day beforehand, it's best to do that. Post-procedure, something important to note is try not to play around with the area of treatment very much. For example, if you had your lips injected, try not to bite your lip very often. Or if you had your cheeks recently done, try not to sleep on a firm surface immediately after the treatment, just because the dermal filler can still shift a little bit for up to a week after your treatment. It could change the shape of that treatment, and that's something you don't want.